I'm Kamara.
Hi.
We met earlier.
Good to see you.
Yeah, I'm just checking in. Is it okay that we still have this conversation today and talk a little bit about Jacob's illness and where things might be going?
Yes.
That's still fine.
Mm-hmm.
Okay. A really good way for me to learn more is to find out first how what is your understanding of where Jacob is at with his illness right now?
He's 1 year old.
Mm-hmm.
We're in a Facebook group, and what I gather is kids with his condition, Menke's, they don't live past 2.
Okay.
Which is really hard for me to believe because he's been so robust.
Mm-hmm.
But in this last hospitalization, we really thought that we would lose him.
Oh.
It was terrifying.
Okay. So he was hospitalized and he was quite sick.
Yeah, he had RSV infection and trouble breathing. It was very scary.
Okay. So on the one hand, you recognize that, you know, he's very fragile at that point when he had that infection, but other times he actually can feel very well.
Yeah.
Seem very, very well.
Whereas his normal is different, but we know him that way, and it's Jacob.
Yeah. How much information would you like from me about what might be ahead with Jacob's illness?
I want to know everything. I'm very terrified to know. I'm scared, but I think I need to know it.
Okay. So, like you said, with the Menke's, we know it's a progressive condition, and that over time, he's going to become more weak and have more problems. At the same time, we also aren't very good at predicting the future, and there's a lot of uncertainty in that. And right now, he sounds like he's doing quite well. And as I said before, and as you've said, he also is very fragile, and he is at risk to have an infection and to have more difficulties. And so I think in knowing sort of this, a little bit of an uncertain future, what's helpful is if we actually know what would be some of your goals for him with his illness and with the future thinking with his illness. What are some important things for your family?
We do best when we're a family together.
Mm-hmm.
I want Jacob to be with us. I want him to be with his sister. I know sometimes he may have to go to the hospital, but I don't want to have to go through what we went through the last time, but I don't know if that's avoidable.
Okay. So being together is really important to you guys. Yeah. Sounds like going to hospital and him being sick is a worry. Do you have other fears and worries that come up when you think about Jacob's future with his illness?
I feel like I can't see him gasping for air or this choking that he's doing. It's horrible as a mother to see this.
Right.
So I guess his breathing is one of my major concerns, that he's going to have an episode. He might suddenly just die on us. I don't know. Okay. It's horrible.
Right. And in that breathing and difficulty, you see that he's scared and he's hurting.
Yeah.
Yeah. Okay. What gives you strength as you think about the future with Jacob's illness?
I imagine making more memories with his family, with his cousins and his sister. Yeah, he loves his sister. She makes him smile. I just want to, that makes me happy and makes me hopeful for the future.
So time together, marking those special occasions and capturing those moments that you have right now are so important. What abilities are so important to Jacob's life that you can't imagine him living without?
You know, he loves to have little tastes of food. That makes him smile and makes him happy, and I can see with this choking episodes that we're kind of losing that, and it's really heartbreaking. I just can't imagine not being able to do that with him, and I don't want to lose like his essence and his smile.
I'm hearing you're seeing things change because of the condition he has and some of those abilities.
Yeah.
It's hard to see those losses.
Mm-hmm.
Yeah. You may or may not be able to answer this, but I think you've shared a little bit about how you're anticipating and thinking ahead. So I do wonder, if Jacob does become sicker, have you thought about how much medical intervention or treatment you would want him to go through for the possibility of gaining more time?
Yeah, I struggle with it. My husband and I have talked about it. I really don't know.
Mm-hmm.
I don't want Jacob to feel scared. I see when he goes to the hospital, I can't explain things to him. He has no way to protect himself, and it's just so hard as a mom to see that. If it could give us more time and it's not gonna hurt him, then maybe I would, but I'm honestly, I'm not really sure at this time.
Mm-hmm.
Kids, on our Facebook group, I've seen parents take their kid to the hospital and they, have all these tubes and interventions, and I feel like, am I supposed to be doing that with him? Is that going to prolong his life? Is that the right thing to do? And is it the right thing to not do that?
Right. Yeah. So you and your husband have a lot of questions. What is best for Jacob? What other people do? All of those things influence our decisions.
Yeah.
Well, thank you, Jen, so much for sharing with me. I feel like I have a better understanding of some of the things you're worried about, some things you're thinking about. And my recommendation is actually that we follow up in next week. I know that's a time that your husband can also join you.
Yeah.
It'll also give us a bit more chance to talk to some of the specialists that are involved in his care, your Jacob's neurologist and also the respirologist that took care of him last time he was here.
Yeah.
Because I wonder if having a plan outlining some of the things that might be ahead.
Yes.
And then what are the things that would most benefit him? What would be the things that maybe you would want to try? And maybe some of the things that you wouldn't want.
Mm-hmm.
So if we met next week and just kind of continue with this conversation, does that work?
Yeah, that would be great. Yeah. Thanks, Tamara.
I really appreciate the time.